So my name is Ena and this is Jo. And actually, we are both physiotherapists by background, but more recently in the last year or so, we've been started to become like champions a bit more for allied health professionals on the whole, trying to promote the good that we're doing and spreading the word about wanting to make sure that people can maybe potentially join our professions and join us on the front line of doing things. So we didn't actually necessarily know that we were leading this session, but we're more than happy to have a chat with people. I think it would be great if it could be a bit interactive. Maybe if you can just maybe pop stuff in the chat if you have any questions. But in terms of from our perspective, so Jo and I, about, I think it was March time, basically in the height of COVID-19, we very much realised that a lot of people were getting a lot of press, well, doctors and nurses, and about the great work that they were doing. But we knew that allied health professionals and all of our 14 professions were very much on the front line at the time and doing so much to help our patients recover from COVID and making sure that they were getting the care that they needed, the rehabilitation they needed, and as well as being able to recover at home and helping them facilitate them getting home safely. So then we were like, maybe it's about time that we put allied health professionals on the map somehow. Jo and I are both working at the moment, but we aren't necessarily in managerial positions. We are definitely more, both of us are band sixes at the moment, and we wanted to try and help promote as best as possible. So we started a Facebook page called On the Frontline AHPs, and started basically promoting all the different professions and finding out exactly what people were doing around their participation in COVID and how they were helping all the patients. And we did a lot of appreciation posts. We posted each profession a little summary about what they did and great things that they're doing at this time. And we had a lot of got a lot of feedback and a lot of backing, which was amazing. And then it kind of spread from there, really. And then the Facebook page grew. We had a lot of people sending us in things that allied health professionals were doing. They were sending in various videos, articles, and we were posting this on our Instagram and our Facebook page. And then off the back of that, we've definitely stumbled more into the allied health professions with promoting kind of format and wanting to make sure that we try and help with that regards. And one of the ways that we've done that has been by starting a podcast. So we started a podcast maybe about 4 months ago, and it's called AHPs Off the Record. And the premise of the podcast is that we're going to interview various professionals, allied health professionals at different stages of their careers, basically getting them to have a reflection on their career, what they enjoy about their job, how they found becoming an allied health professional, how they discovered their profession, things they didn't know, top tips for their for aspiring students to want to be an AHP or their specific profession. So we've been doing that for the last 4 or 5 months, interviewing a variety of professions, and it's been so eye-opening to learn about what each other profession is doing. Because as a physio ourselves, sometimes you don't necessarily get to know about all the different professions. And we work very closely with occupational therapists, podiatrists, speech and language therapists, acutely on the wards, but actually when it comes to the wider things, maybe paramedics. I've worked a little bit of paramedics, but drama therapists, music therapists, and art therapists. There really is there's such a variety. I've learned so much by doing all the stuff that we've been doing in the last year or so. Yeah, Jo, do you want to add anything to that? And then we can maybe start answering some questions.
Can you hear me?
Yeah, we can.
I'm not. Oh my God, thank God. Sorry guys, I think my microphone wasn't working before, so I've been sitting here thinking, I'm listening to everything you're saying and I'm really hoping I'm going to be able to speak afterwards. I think you've given a really good summary, Anna. I think essentially by doing the podcast, I think we've learned so much about all the different 14 allied health professions, and I've become so much more aware of how awesome the sort of AHP role as a wider opportunity is, and how many opportunities there are within that. So I think there are so many great different sort of career paths that you can take within the allied health professions roles. And I think that hopefully anyone listening to our podcasts will be able to get a good idea of the day in the life of the professions that we are interviewing. So it would hopefully be a good way to find out a bit more.
Yeah.
I've seen a question from Georgina, who's asking about sort of trying to decide between being a paramedic or a physio. So in terms of a day in the life of a physio, I guess it kind of depends on what area of physio that you're in. Ena and I have both, when we qualified, we both rotated around different areas of physio. So we've had experience in most of the different areas now. I'd say if you're working in an inpatient setting, then a normal day would be coming in, sort of probably having a brief meeting with your colleagues, having a look at your caseload and planning your day, sort of thinking about what priorities you have in terms of different patients. So writing a list of who you need to see and working out which patients you might need to see first and why. My experience of physio is it's generally very sociable teams. There's a good amount of teamwork, and you end up working with so many different professions. So we work very closely with occupational therapists, with speech and language therapists, and also with dietitians and doctors. So there's a lot of multidisciplinary working. We do have meetings, for example, with the doctors and nurses to talk about patients and develop plans for them. We do generally a lot of teaching within teams, so looking at journal articles or learning new skills, helping each other out with things that we haven't done before, and a lot of thinking about the onward plans for patients and sending referrals, working out where they can go, for example, if they're leaving hospital. One thing I would say is that within physio, for me, every day is different. You never know what challenges you're going to come across. You never know what patients are going to be admitted. So it's a constant challenge, and it's really exciting, and you're always learning. I don't know. I can't comment a huge amount on the day in the life of a paramedic, having not been one myself, but I imagine there are equal sort of exciting and very variable roles within that as well. So I think both are amazing careers to go down. Most challenging aspects of being a physio. I would say it's challenging and also really enjoyable. Getting to know lots and lots of different patients and getting your sort of fingers really deep in what's going on with them, trying to work out what's going on with them and work out the best way to help them. It can be very, very busy, managing a busy caseload on a ward, for example, if you are in charge of a whole ward. But that also can be very rewarding, and seeing the benefits that you are helping a patient to make, helping to get them doing things more independently by themselves, helping them to recover from a surgery or from an illness. Ena, what do you think? Any ideas of the most challenging aspects of being a physio? I've lost Ena again. Any parts of your role as a physio that someone aspiring to apply might not expect? I would say one of the areas of physio that people don't know so much about is the respiratory side of physio. So physios work in loads of different areas. I think that the areas of physio that people mainly seem to know about are sports physio or musculoskeletal physio. And that's where patients will come to you as normally in an outpatient setting. For example, if they have injured themselves, if they've had sort of ongoing chronic pain or new injuries, and you would be treating them giving them exercises and sometimes doing manual hands-on therapy to try and help them recover from that. And in terms of other musculoskeletal or orthopedic physio, it might be helping someone to recover from, for example, surgery to their knee, like an ACL repair or a hip replacement, that sort of thing. But I'd say the areas of physio that people don't know so much about, physios play a big role, for example, in intensive care and doing chest physio. So within sort of respiratory chest physio, we are looking more at the lungs rather than the rest of the body. And we are helping people, for example, with their breathing, to help them manage their breathing better, to help them clear secretions. And we also provide an on-call service. So in most hospitals, there's always an on-call physio overnight who could be called in to see patients who, for example, have deteriorated with their breathing or have lots of secretions on their chest and are unable to clear them independently. I'd say that's probably one of the main areas of physio that people don't know about so much.
I think, is that still for the first question? Sorry, I had technical issues.
That's all right. I wonder where you're going. That was for the question about the most challenging aspects to being physio and parts of the role that people might not know about.
I've covered most of that. What qualifications do you need to be a physio? So I think there's different ways that you can do it. So you've got you can do it through undergraduate, so a BSc degree. So usually that would require, in terms of A levels, you probably need A levels within either like a biology background or a sports or a PE background. I think there tends to need to be one science within your A levels to apply. In terms of, for me, I did a MSc, so I did a master's. I did sport and exercise science first as a degree, a 3-year degree, and then did a 2 years master's in physiotherapy as a pre-registration course. So that's a different way of going into it. If there's something else that you wanted to do first and you weren't quite sure, there's definitely master's opportunities to be able to be a physio. And then also there is a lot of apprenticeships at the moment as well. So for instance, if you were a therapy assistant currently working in a trust, you were helping occupational therapists, physiotherapists, you can apply to do an apprenticeship. So you can still work at the same time, but then also be training up to do your degree. So there's definitely different ways to go around it. Have you had the opportunity to work
in terms of
Oh, sorry, Jo.
I was going to say I haven't personally worked with a sports team, but I know that during my course, so I did the BSc course, the 3 years at the University of Birmingham, and people on my course were actually sort of, even during the course, they were starting to work with the uni sports teams, providing, for example, on the side of the pitch assessments, and also seeing them for general sort of injuries across their training period. And I do know some members of my course, there's definitely one who has gone on to be the physio with a football team, a couple that have gone on to be physios of rugby teams. So there are lots of opportunities available. I think one of the big things is that lots of people, including myself, when they apply for physio, they think, oh, you know, I'm going to be the physio for a rugby team, or I'm going to definitely go into sports. And then you start the course and you realise that is an awesome opportunity, but there are also so many other opportunities available. And you know, my experience of physio since qualifying has been very different to, and the things I've enjoyed have been very different to what I thought I would enjoy before I started the course.
I work in outpatients at the moment. So I specialise in pelvic health, which is I work with pregnant patients and so obstetric patients, and also any women or men who have any kind of like bladder or bowel dysfunctions, which is definitely a specialist or a different area of physio that people may not necessarily know about. But because I work in outpatients is a little bit more geared towards the kind of sporting background. A lot of people that I work with currently are working in outpatient departments, but are also pitch side physiotherapists for rugby teams and football teams, usually junior teams. at the moment until they can work their way up. And that's probably something that I think a couple of them will definitely be wanting to do. So, and when I studied, to get some experience, I did some pitch side. So I did some pitch side work whilst I was studying, because there was some opportunity through my university to do some rugby pitch side massage, and then also something for the actual games as well, which was really good experience. And there was about 5 or 6 of us, and I know a few people who had that experience have definitely gone on to do sports. So if that's what you want to do, there's definitely opportunity to do it. You probably have to seek it out a little bit more in terms of gaining experience, but the opportunities are definitely there, and it's not that uncommon either. Next question: how did you find the transition from sports science BSc to physio MSc? How intense was the course? So I didn't have a gap in between. I think I was in my second year of doing my sports science degree, where I was very much just like, actually, I think I really want to do physio. So when I applied straight away. The 2-year course is intense. I'm not going to lie. You're doing a lot of your placements kind of within a small space of time, but it's completely worth it. And I think especially at that point, you're kind of wanting to get up and running. You've done a degree before, so you're kind of just like, I just want to get into doing that job. So actually, the 2-year course, even though it was quite intense, I still think it was completely worth it and worth doing. And I know that they're doing that for occupational therapy, speech and language therapy, maybe less so for like art, music, and drama therapy. I think they might be the same for radiographers. But there's definitely that opportunity to have that accelerated course after doing a previous degree.
Do you interact with radiographers and or therapists often? I think in an inpatient setting, we do see radiographers, and we see them sort of coming around to come and do, for example, portable scans on patients that we are involved with. So there might be some interaction on the ward, for example, when they are coming to do scans. In general, when scans and things have been done, they would generally then be reported, and we would more be interacting with the doctors on the ward to review the results of that scan and see how they apply to our practice. But I think in terms of outpatient physio, there's definitely there are more and more physios who are getting extra training and responsibilities to then be able to, for example, bypass GPs and be able to order things like X-rays and MRIs for their patients. Lots of extended scope physiotherapists who have done extra qualifications in order to be able to do that. And I think that they then would have more direct interaction probably with radiographers. But in terms of in an inpatient setting, we're not generally sort of communicating with radiographers on a day-to-day basis or planning with them. It'd be more that we would see them when they happen to be coming to
and I think more recently, patients. I think we've just started to learn a little bit more about radiographers and the different types, like therapeutic, and like it's been quite interesting again from doing the page and the podcast that we've learned a lot more about the different types of radiography and how much is involved, and their input over the last over the COVID period as well has been like exponential. Everyone's been really kind of stretching themselves to either stretch themselves within their profession or stretching themselves kind of outside it. Oh, hello. Hi, Tanisha.
Amazing with my really bad camera.
Yeah. Oh wait, there's more questions. How can I strengthen my application for physiotherapy and put myself above others, especially during this global pandemic? And also, what is your least favorite thing about physiotherapy? Jo, do you want to go first?
In terms of strengthening your application, I think a really important thing is making sure that you get across that you have an understanding of physiotherapy as a whole. So I think, as we've mentioned, I think a lot of people, if you ask the general public what a physio is, they'd probably be quite confident that they knew. But if you then start picking into that, they'd probably say, oh, you know, physios, they do massage and injuries. And a lot of people are actually really surprised when we tell them the full scope of what a physio does. So I think having, even if you know from the beginning what area of physio you want to go into, I think there are lots of people who do a physio course knowing exactly, you know, that they are interested in sports injuries or sports teams and that sort of thing. But regardless of that, to make sure that you have a fighting chance of getting onto the courses, it's really important to demonstrate that you understand the whole range of what physiotherapists do. Another thing that I think is really useful, but again quite difficult at the moment, is to try and get some work experience. Personally, the way I managed to do that was, luckily I had some family friends who were physios, and I managed to organise it directly through those. But most trusts do have sort of specific work experience programmes available in normal times. It can be a bit more difficult at the moment, I think, with the pandemic and trying to have as few people in sort of acute hospital environments as possible. But definitely, you know, expressing, even if you're unable to organise any work experience, expressing perhaps that you've made an effort and that you do have an awareness of all the different areas of physio.
I even think
really
attending
helpful.
something like this and putting this on your CV or putting this on your personal statement would look really good. Like the fact that you're actively seeking out and asking questions to find out more about the profession as a whole. And I mean, this conference is recognised by like those are national NHS England and things like that. So it's established, and the fact that you've taken your time out on a Saturday to come and find out more information shows how much you want to be in that role. I think also what's quite important on your personal statements is to make sure that you write like things that you do outside of kind of like education and physio specific things that would be useful to being a physio, because being a physio isn't all about just being like a hands-on person. Being able to, it's about problem solving, and it is like thinking on the spot. It's about being able to communicate with people and being able to talk to people. And if you can kind of pull that out from different areas of your life through various other experiences, doesn't need to even be physio related or even healthcare related, I think that shows I think that really shows a lot in terms of your adaptability and your flexibility, and that looks really favorably upon. So thinking outside of the box sometimes is a little bit better than necessarily just trying to get those tick boxes as well. Yeah.
In terms of favourite and least favourite thing about physiotherapy, I think my favourite thing is I feel very honoured to get to know so many different people from so many different sort of backgrounds, with so many different conditions. I feel like as a physio, people trust you a lot, and you get really let into people's lives, and they quite quickly tell you a lot of information about themselves. You get to know them really well, and you can really feel that you are making a difference to someone's life. So I think that's a really, really powerful relationship to be able to build with someone, and it can be really, really rewarding. In terms of my least favourite thing about physiotherapy, I don't really know. I probably, when I was starting out and I was a bit freaked out by it, I would probably say having to deal with respiratory physio and people's phlegm was a bit gross. But actually, even that, I've you know, as you become more confident in things, because I think a lot of the scary things about physiotherapy is that there is such a broad range of skills to learn, which can be a bit nerve-wracking, but is also really exciting. So I think the things that I probably didn't like it so much before were things that I didn't feel that confident in, and I think as I progressed with my career, I've actually just come to like pretty much every aspect of my job, which is really lucky.
I would say probably really similar to Jo. I think what I really enjoy about physio, and I think again it's probably changed a bit in the sense of, obviously blanket helping people is by far like the best bit. Like you get to help people and seeing people's recovery and seeing them improve and helping them get home safely and see their families, like there's nothing that can beat that. But the more that we've kind of gone through and kind of gone through our different rotations and gone to different places, I think I really like the variety. I think if you wanted to, you could keep changing different areas for like the rest of your career. There's so many different avenues, and we're only just finding out more about the different avenues that they can be. If you wanted to do research, if you wanted to do sports, if you wanted to be a lecturer, if you wanted to be promote AHPs and like just go around traveling around and doing that, like there's so much opportunity from doing that degree. I never feel like once you've picked that profession that you're necessarily stuck. There's so many opportunities that you can get from it. What's my least favorite thing about physiotherapy? What is it? I think initially it would have been being on call sometimes. I think being on call was a tricky one to start off with. So if you didn't know, in terms of sometimes within physiotherapy, because of the respiratory aspect of our role, most trusts and most hospitals run an on-call service. So this is when a patient becomes acutely unwell in the night, overnight, and need help to clear secretions or clear phlegm from their chest, and that's kind of what the role of physiotherapy within that is. And you can get called out. So basically, one person a night will be on call, and if a patient needs to, a doctor will call you in the middle of the night, and then you'll have to come in and then see the patient. So people probably wouldn't necessarily think that physios have to do that, but that is part of it. And I mean, as a person who loves my sleep, it was at times it was a bit tough, but again, it's still a reward. It's still so rewarding knowing that you're that person, because again, I don't think people think that physios can be that acutely needed in that kind of crisis situation. You're being called on to try and help this person because they feel that there's no other avenue, which I think is sometimes can be a bit daunting, but I think it really shows how much our professions are needed and the scope of which we cover within healthcare. I think it's really important. It's really important. What demographics do you deal with most?
Very varied, really. I personally work in a hospital in North London, and I work with, the boroughs that we serve are very, very ethnically diverse. I wouldn't say that there's a particular demographic that I deal with most, because it's just a huge range of people, and it just depends who happens to be coming into the hospital. But as I said, the areas that I've worked in have had diverse populations.
Yeah, I would say same with me.
I think that was the same when we were.
Yeah, apart from I specialise now within pelvic health, my demographic is dominantly women. Women of varying, varying ages. I go through all ages, but my population is predominantly pregnant women. With a few men, but that's only because I've specialised. But before, it would have been everyone from we've worked with children as young as like 6 months to elderly patients that are over 100. So you will see the full scope, and I think that's also part of what's enjoyable about the job. Would you recommend doing a mini project on COVID-19 and the effect it has had on physiotherapy, and put this in my personal statement? I probably would look quite good, I'm not going to lie.
Mm-hmm. The thing to consider is being cautious with your word count as well. It's so difficult with a personal statement to get the right balance of, and I say this is probably for any personal statement, for any AHP careers or courses, it's getting the right balance of having in enough information without it being a huge essay that because they want you to be able to write good quality applications without sort of going on and on and on. So trying to get that balance can be quite difficult, but I think that would look very, very sort of current and relevant. So I think that'd be a good idea. In terms of dietitians, I have worked with quite a few dietitians, sort of not in terms of doing joint sessions with them as such, but I have had quite a lot of exposure to dietitians, and I think we also have learned more about dietitians by doing our appreciation posts on our page about them, and also we do plan to interview a dietitian for our podcast as well. In terms of the roles of a dietitian, I'm looking back to our appreciation post as well to try and make sure I don't miss anything.
I was just about to say that.
But they do play a huge role because they're
trying to find it. I'm just like, yeah.
Yeah, I found it while you were talking about something else. I was like, I'm going to be prepared for
Love that
question. Essentially, so dietitians work with people of all stages of their lives, and they're specialising in sort of nutrition and hydration, which are both essential to survival. So they're looking into helping people improve their health and or manage medical conditions via giving advice on or modifying their diet. And they particularly are very important, for example, with certain medical conditions, people who have problems with their kidneys, making sure that they are trying to optimize their diet to optimize their sort of health. But one of the other things that dietitians are massively involved with, which people don't sort of tend to realize so much, is that, for example, patients who have been very unwell and maybe in intensive care, who are unable to eat or drink, have then been often fed by a tube that's normally going into their nose, or some patients who are unable to eat or drink because of being unable to swallow, or due to other medical conditions, they might also have a feeding tube going straight into their stomach. And dietitians are critical in sort of managing the nutrition and hydration that they receive through that tube, monitoring the different sort of balances of what that patient needs depending on their nutritional requirements, monitoring their weight and making sure that they're receiving adequate nutrition. And they would then be involved in, as patients, for example, if they have been unwell in intensive care and are not unable to eat just because of being unwell, they'd then be very much involved in as a patient recovers, helping them to get back towards eating and drinking orally, and guiding that transition between tube feeding and eating and drinking normal food. They also are... let me just review the post again. I think I've covered most of the stuff that we were saying, but essentially they play a huge role in all different areas of the hospital and in the community as well. And they play a really important role for patients who have gone home from hospital, monitoring them and making sure that they are remaining healthy and optimizing their sort of nutritional intake where possible.
I think you smashed that, Jo. Considering you're not a dietitian, I thought that was very good.
Trying my best.
Yeah, no, I think that
do
was
I need an A-level A?
I wrote in the back that one because I don't think you do, but I was like, each university has, if you look at each university for a physiotherapy degree in any of the AHP professions, look at the university like spec. They'll tell you about the entry requirements and what the specific marks they need. I feel like very rarely will most professions be like, you need specifically an A in that profession, in that subject, sorry. I think it's kind of across the board. Like it might be that you need an A and two Bs, but one of them needs to at least be a science. I think that's the general gist, but I would definitely have a look at the specific university and what their entry requirements are. Don't stress yourself out like that. It's not worth it. About the MSc physio course, which uni did you study at and would you recommend it? Did you find that the BSc sports science helped you with learning the content on the physio course? Does the content differ in the different unis? So I did my sports science degree at Loughborough, and then moved to London, did my MSc at St George's University, which is in South London, in Tooting. Did I find? I think the expectations in the MSc was basically more that from an anatomy point of view, they kind of felt that you should know that from your previous degree. So you would have covered that predominantly in your sports science degree, and then it was more about learning kind of like the physio-specific skills. So kind of all the background knowledge they kind of expected you to know, and then it was kind of you go in there all guns blazing just to learn specifically the skills for each of the different areas that you'd need to cover when you're on your placements. And I don't think the content changes that much per university. I'm pretty sure it's the same across the board. You usually do your MSK, so your musculoskeletal module. You'll do a neuro, so like a neurology module. You'll do a respiratory module. You'll do your research module, so your typical like dissertation and research projects and all of like coursework. So those will be covering like the basics, and then you'll be on your placement for a fair few of those weeks. So most placements tend to last between 5 and 6 weeks, and I think I did 6 placements at a time. So I did 6 placements at 6 different hospitals across London, which is the same as the BSc. So you're not really missing out in terms of doing any less. You're doing the same, but you're just fitting it in a slightly smaller capacity. That's all. But I thought, yeah, I enjoyed it. It was good.
And I think the placement structure is probably quite similar to other AHP courses as well. I know that when I was on placement as a physio student, there were also definitely speech and language therapy, occupational therapy, and dietitian students who were doing sort of similar placement structures.
Yeah, I think I agree with that.
If I got a degree in either physio or paramedicine and then decided the degree profession wasn't for me, do I have? I think one of the really good things about a physio degree is the transferable skills that you get. I think by working on your placements, you get really amazing interpersonal skills. You have to be able to communicate really, really well with both your immediate team and also the wider medical team. I think you get an opportunity to work with people of so many different backgrounds, patients of different ages, different styles of communication with different needs, and you learn to be really, really flexible and to be able to meet their needs and adapt the way that you offer your intervention depending on the people that you're looking after and dealing with. I think that you get really great organizational skills from the responsibilities that you have. Even on placement, you're having to coordinate doing your treatments, factoring timings for administration, writing notes, doing referrals, having meetings. And in terms of the course as well, obviously, the stuff that you are learning is specific to your profession, but I think with any university course, doing that sort of intense learning, training your brain to be able to take on new information, and particularly writing your dissertation, you get experience in either research or looking into. So I think there are so many transferable skills from doing the degree, even if you get to the end of it and think, oh, actually, this wasn't quite what I wanted to do.
I think also you've got the whole I think you might have mentioned it, but the whole non-clinical aspect of it in terms of the managerial side. If you actually find that you what am I trying to say? Where your strengths lie are more to do with like team management, and actually you are, as Jo said, extremely organized and just helping to structure a team and manage people above and below, or just having a look into wider careers within like NHS England, and kind of like there's so much that you could do with that profession. That being said, I've also known a physio who's then gone into finance after doing their degree. So, and I don't think they necessarily did another degree afterwards. I think they stayed within the NHS and kind of just went into the finance team, because that's just kind of like their skills were transferable to that. So I don't ever feel like you're you'd be stuck in a profession once you've chosen to do it. Are there any common questions that I prepare for, assuming I will get an interview for physio? I'm trying to think back.
Yeah, me too. I think they want to know, not just that you have an interest in physio, but they want to get a good idea of your interpersonal skills and being able to work within a team. I remember in my interview, I remember doing not just a personal interview, but also a group discussion. And one of the really big things that the facilitators were looking for was people being able to speak in a group, but also be conscious of the opinions of other people and be able to work as part of a team to come to a conclusion rather than sort of dominating a conversation and just giving your own ideas. So I think that was one of the huge things that they were looking for, because a great big part of being a physio is being able to work within a team and communicate with other people.
Yeah.
I'm trying to think. I think they also want to get an idea of your interpersonal skills in terms of patience as well, and ability to demonstrate sort of empathy. And again, I think, as I mentioned before about your personal statement, I think they will ask you information about your understanding of the whole range of physio as a profession, rather than just the specific areas that you're interested in.
No, I think that's you've covered that. I think that's true. I know you usually need volunteering work when applying for physio, but because of COVID-19, I'm struggling to get any alternatives you could suggest. I wouldn't say you necessarily have to. I think it helps, but I don't think it's necessarily a given that you have to have work experience, and I think, especially with what's happening now, I think they'll probably be very understanding if you don't have any work experience on your personal statement. Like, you haven't been able to get the chance, there hasn't really been the opportunity to. So it's the same for everyone, really. I think I wouldn't worry too much about it. In terms of suggestions, as I said before, like saying that you've attended an event like this, is basically showing that you've been trying to find ways to get experience and get exposure to the profession that you want to try and join. So yeah, I wouldn't worry too much about the fact that you can't necessarily get some work experience. I don't think they'll mind too much. Just basically show how much you want the role, and you've been researching it, and that should be enough to cover that, I think.
I know I think it's the Health Education England website as well, there were some videos that were sort of showing a day in the life of certain AHP professions. Even mentioning that you've sort of watched and considered the relevant one of those, and have an understanding of what the role involves, I think that would be really helpful. And as Anna said, I think people will be very understanding that it's not easy to get yourself into an acute hospital at the moment to get sort of hands-on experience. But yeah, just using whatever resources that are available online, and I think there are more and more popping up as things have become a lot more virtual this year. So just demonstrating that you have taken the initiative to explore whatever resources are available and learn from those, I think would be really helpful.
And actually, social media at the moment is just rife and full of so many useful resources. So get on Instagram, get on Twitter. Like, healthcare on the whole on Twitter is like, there's so many resources and so much information on there. And actually, I think I remember that being a question in terms of, I think it was a Band 5 question. One of the questions was like, outside of your usual work, like, how do you find information about your role, or how do you we call it like CPD, which is like continuing professional development, like how do you source information? And actually, I remember in an interview, one of the boys was like, well, I actually use Twitter and I use Instagram, because there's lots of articles on there, there's lots of papers and people are sharing about what's current in terms of research. So, and he said that in an interview, we were all just like, that's completely fair, because they're useful resources and you have to use what's out there to help you. And that's not just physio, that is within all of the AHPs in terms of especially on Twitter. And I mean, we're trying to get it up and going as much as we can in terms of on Facebook and Instagram, but there's so many different resources out there and there's so much information to utilize it and use it as much as you can.
The other thing is that I know if people don't, for example, don't manage to get onto a course and they think that lack of experience is something contributing to that, I know that a lot of people do take the route of, for example, working as a healthcare assistant or a therapy assistant before applying for an AHP role. And there are roles in, even if it's not physio that you're interested in, there are assistant roles in speech and language therapy, in dietetics, in basically most, all of the AHP professions do have support worker roles as well. So, and even having experience as a healthcare assistant and just having hands-on experience looking with and dealing with patients on a daily basis, even if it's not specifically relevant to the course that you're applying for, can be really, really useful in just showing that you have had some experience working with patients regularly. So if you are struggling to get onto a course and want something to do sort of in the meantime of waiting until the following year when you can apply, then I think trying to get yourself into a role like that could be really helpful for supporting your application.
I think I'm aware that we've talked a lot about physio because that's just that's what our professions are. But yeah, if anybody does have, we've been trying and learning a lot about all the other professions, and we can definitely just go and have a quick look back onto our all the appreciation posts and things that we've done to find out and just tell you guys a little bit more information about the other professions. So if anyone has any questions other than physio, although we can keep talking about physio if you want to, but all the other professions are just as great. So yeah, if you have any questions, then please just keep typing bits.
I have a question.
Oh yeah, feel free.
Sorry. If you could sort of put yourself back into like 16 to 18 years old, what do you wish you knew before you began your career towards physio and you're specializing? Sort of, what do you wish you knew?
Do you want to go first, Jo, or am I go first?
You go, I'm thinking.
So when I was 16, so I came from a sporting background. I played tennis to like a national, international standard when I was younger, and had a lot of experience with physios for when I was injured. So that was kind of that was what I saw physiotherapy as. And when I was getting more injured and I was thinking this probably isn't going to be the route that I'm going down, I was like, physio is the next step. And then when I actually did some research into what physio actually entailed at the time, because I didn't know more about it, and I had to go and have a look and see, and did a bit of work experience. And actually at the time I wasn't ready. I definitely wasn't ready to do it at 16, 18. And I said that, I was like, this isn't what I was expecting it to be, and I don't think I'm ready to do it. So I'm going to go and do a different degree and then come back to it if that's what I wanted to do. Now looking back at it, I probably would have, I think especially in current climate, it would have been better if I just done it straight away, I think, because I ended up going that route anyway. I think if you've kind of got a gut feeling in terms of that's what you want to do, and done a lot of research, and I probably would have done it straight away. And actually, I think my parents are both in like healthcare as well, so I had a bit more experience from that point of view. But I think knowing what I know now in terms of how important physiotherapy is and allied health professions and what they contribute to in terms of how patients respond, how much they're needed to help patients recover, improve their quality of life, then I probably would have definitely just done it like quicker, just been like, physios, AHPs, they know what they're doing, they're really important, like go for it. I think I would have probably bigged us up a little bit more if I, at the age of 16, I think, knowing what I know now.
Yeah, I think I'm similar. I was lucky in that I sort of happened upon physio. I had completely different plans for myself. I was going to go to drama school or art school. And then I actually injured my ankle and was going to a physio, and then thought, oh, this is quite a good profession. But if that hadn't happened, I don't think it would have ever really been in my mind as an option. And at that point, I'd never heard of an allied health professional. I'd never heard definitely of, I'd heard of a physio, but I didn't really know what they did. I'd never heard of a speech and language therapist. I probably would have been able to guess what a dietitian did, but not all of it. Didn't know about OTs. I didn't know about podiatry. I basically didn't know about any AHPs. And I don't think that they're really on the radar of most schools' careers opportunities. And I think that's crazy and I think things like this, which are so important, are working to raise the profile and try and educate people on how many healthcare opportunities there are. But really, in lots of schools, I think if you're interested in healthcare, then the options really that are presented to you openly are medicine, nursing,
midwifery.
That's pretty much it. Maybe midwifery, or maybe optician or something, or dentist, I think. But apart from those, which are kind of the more obvious things, I don't think it was really presented as an option. And I feel very lucky that I sort of then did stumble upon it and decide to try it. So I think I would really have liked to age 16 or 18 been able to attend something like this, or have AHPs coming into school to explain their roles and understand more, so that I could have made an informed choice about, maybe I would have gone into speech and language therapy, or maybe
drama
I would have
therapy,
become an author. Exactly. There are so many different opportunities within AHP, and I think I would have loved to know more a lot younger. Luckily, I've found an area that I love, but I think that's
actually really true. When I think back at it, I think when I was applying in terms of like A levels and things, I'm pretty sure, I think there was maybe one other person in my year group that had applied to be a physio. And I'm going to say nobody else in my year group had applied to be an occupational therapist or any kind of other AHP profession at the time. It just wasn't really, as I said, it wasn't talked about, and just wasn't, I don't know. Yeah, it just wasn't talked about. So I think it is, as you said, the more things like this can come about, the more that we can get into schools and help promote our professions. That's what we need to do. And I think that's again why I think since we've started the Facebook page and the podcast, we really want to try and get, in terms of hopefully to students more so, just to be like, our professions are really good and we're just as important as other medical professionals that might be in the spotlight a little bit more. We're doing just as much, and we're just as needed. So yeah, I think that's really important. That was a good question.
We've got a question from Jake wanting to know, I've heard you have to know anatomy inside out. Is this true? And how much of the studying is independent study? So there is a big amount of anatomy in the physio degree. You do end up having to learn all of your muscles and where they originate, where they insert, all of the bones. A lot of stuff that actually then probably forget when you start working. You'll be able to remember it in terms of looking it up and referring back to it and thinking, oh yeah, that sounds familiar. But I definitely wouldn't be able to say off the top of my head where every single muscle in the body originates and inserts now. You do unfortunately have to learn it for the course, but I think that is really valuable in then being able to think back to it and recall it when you do need to know it for a specific patient.
The physiotherapy pocketbook is a godsend, by the way, for saying that.
Yeah,
for any potential
really handy
physios.
And there's a neurological one as well, which was really useful for me when I started specialising in neurology. In terms of how much of the studying is independent study, on my course we were in uni a lot of the time. So I think a lot of university courses are only a few hours a week of lectures and then a lot of independent study. Whereas physio, we were generally in uni sort of 9 till 5 most days. I think we had, at my course, we had Wednesday afternoons off. I think at the moment, most of the unis are doing virtual classes a lot of the time rather than sort of face-to-face. But it's still, regardless of that, it still would involve a lot of actual lecture teaching time, rather than just sort of saying, okay, well, here's 2 hours a week of lectures and then you go away and do lots of reading. So it does need to be very interactive and having the opportunity to ask lots of questions. I don't know how they're managing at the moment the sort of more practical side of sessions when you're with the virtual teaching. But we had sort of pretty much 50-50 lecture-based sort of presentation lectures, and then hands-on physical sessions where we were getting a good read of each other, learning by touching, which was really valuable.
I've just been asked about the neurology version of the physio pocketbook. Is it just the physiotherapy pocketbook and then neurology, or is it? Yeah, I'll put it in the chat.
Yeah. Let me see if I can find a link to it.
I just typed it in the chat, so hopefully that makes more sense.
That might be useful for me too. So I'm taking.
The physiotherapy pocketbook. Honestly, it was so good. They probably have it as an app now. Like it was. If you ever need to refer it, because it literally could fit into your pocket. You can just pick it up, even when you're during your placements, even whilst you've qualified. Like it's honestly, it was a godsend, that booklet, for every different area of physio. It was really good. How often?
Yeah, the neuro one is called the Pocketbook of Neurological
Maybe type it in the
Physiotherapy.
chat and then just put it in. Cool. How often do you find yourselves having to check tests, anatomy, procedures when working, or do you just get used to remembering what you do with experience? Very much both. Very much both. You definitely pick stuff up with experience, and you tend to see there'll be certain patients that, because of how long you've been working, you'll be able to see patterns, and then you'll be able to just kind of, it will come to you like, I think it's that, or I want to do this test because I suspect this. So your clinical reasoning will definitely, as the longer you work and the more people you see and experience, you definitely will start picking it up, but you will still need to find yourself checking for tests, or you'll still be asking your seniors what's going to be the most appropriate test to do at this given time. This is for any area as well, not just physio, but it's like in all of it. You will never necessarily remember everything, and also as you specialize in different areas, there'll be certain tests for different areas of physio that you wouldn't have used for years. So then if it comes up, you might need to ask that person who works in that speciality. So you will constantly be learning. And also, even when you get to say band 7, band 8 status, there's always still something to learn, and there's still people that will know more than what you know. So then just make sure you use your supervisors, use your whoever's around you that's been there longer, when it comes to like tests, or if it comes to anatomy. I think another thing that was highlighted, especially as Jo quite mentioned, that when you start working, you may start to forget stuff. And actually, there's definitely been times when I've been in a team and the student who's just become a physician come into the team knows like way more than the rest of us in terms of the anatomy, because it's fresh in their mind and they've just been doing it. And then we've been working for so long, just kind of, like I said, working off experience. Then sometimes you do forget these bits, but you are constantly learning. How has the long NHS shifts affected you in your private life? As in, do you still manage to find time for sport and family, or are the shifts too exhausting? I'll go first on that one. Yeah, I can go first. So basically, Georgina, the usual shifts from a physio point of view, and actually I'm going to say most of the AHP profession is from like 8:30 to 4:30. So it'd be like a 7.5 hour day. That's what your usual shift is. So I guess depending on your commute, it could make things a little bit longer, but that is the usual shift. If you want to do, I know some outpatient physiotherapists do private work, they take on private work. So they might do a couple of hours after work, which will obviously make things a little bit longer. In terms of when you're on call, so on call, you only have to go in when you're called in. So if you live close enough to your hospital or where you're working, you can stay at home. So you'll be at home and then they'll call you and then you go in. If you don't, then there's usually hospital accommodation, so you'll stay on site. But you'll have you'll still have free time. It's literally only when you get called in that you need to go. So if, for instance, if you don't get called at all during the night, you could still be at home and it's absolutely fine. So being a relatively active person, I know Jo and I are both quite active people. We try and make time for our sports or our going to the gym. I mean, Jo does a lot of Amdram. She's very talented in the drama aspect. So you do choir, you do drama. There's a lot of time to be able to do painting, like creative stuff. So both of us are quite interested in lots of extracurriculars, and we don't feel like our work is necessarily gone in the way of that. So don't let that put you off any of the AHP professions. You'll have time to do all of that. Don't worry. Oh. So people are talking in the chat. I'm going to let you guys chat for yourselves. What's going on? Do you only recommend the neurology? Are there others? I think there's just the general physio pocketbook, isn't it? Oh yeah,
I've put that in there as well. Just the physiotherapist pocketbook. So that covers kind of all areas of physiotherapy. There are also now there's been an app released called On Call Buddy, which is a really useful one to have on your phone if you are doing respiratory physio, and that sort of gives you pointers for different conditions that you might come across and different treatment methods that you might need to think about. And I think there are lots of other sort of resources popping up that you can download as apps on the phone that can be useful reference points. If you come to a certain patient and you think, I'm not quite sure what to do here. In terms of other resources for neuroscience and neurosurgery, I would say, to be honest, before you start studying, I wouldn't worry about going and sort of buying specific books. I think the modules that you do in university are enough to get you started. I think until you start on courses and sort of work out which areas your course is focusing on, and the universities would generally be able to provide you with ideas of any books that you might want to buy that will complement your studies. But I wouldn't worry about sort of specifically, buying books or resources ahead of time. There's loads of stuff available on the internet. There's a website called Physiopedia, which is quite useful for physio resources, and that gives you a lot of information about the different areas of physio. So I wouldn't worry, as I said, about sort of buying specific or anything ahead of starting a course.
Agreed.
Question: which area of physio did you find hardest to learn? MSK, respiratory, or neuro? They're all quite different. I think in terms of MSK, the difficult thing was learning all of the anatomy. There is a lot of it. There are a huge number of muscles in the body and a huge number of quite specific, as I said, origins and insertions and things to learn for the course. But it is sort of generally learning information that you can then just remember and reel off. But then again, there are lots of, when you're starting to learn about different conditions and different special tests that you might want to think about for different joints, that is quite a lot. In terms of respiratory and neuro, I found in uni it can be a bit, when you're sort of learning in a lecture environment, it can be a bit harder to you're learning information, but you're not really learning it in the context of a specific patient. And I think until you see something that you've learned, definitely in my style of learning, until I've seen something that I've learned in practice and actually seen it being presented with a particular patient, I find it really hard to make sense of it. So I think learning the theory of respiratory and neuro can be a bit difficult, because you're learning about conditions that you haven't had a chance to feel them. You know, you'd be practicing doing different assessments on your peers, but your peers aren't going to be able to fake a certain presentation. They're not going to be able to fake a symptom. So it can be quite difficult to understand that until you see it in practice. But I think that's where having those placements, and having placements in different areas of the specialty, is really, really crucial and useful in complementing the studying that you are doing.
I would say one of the best things, though, is learning or reading something in a textbook, or reading something or learning something in a lecture, and then going and seeing a patient and then seeing it actually in real life was always just a bit just like, oh, that's what it actually, that actually is a thing, or they definitely present that way, which is really interesting and actually really enjoyable as well. So you will learn so much. But I think I completely agree with what Jo's just said. It's kind of hard. Some of them are definitely a lot harder unless you see that person and see that patient face to face. Are there any universities you particularly recommend, or any you think are worth avoiding? I guess it depends where you are. I think we can only speak from being more London based. Oh no, Jo, you went to Birmingham, didn't you? Yeah, you did Birmingham.
Yeah.
I wanted to go to Birmingham, to be fair. I really wanted to go there. But I went to, I was at St. George's. Brunel's also a really good university. UCL, did UCL do a physio course as well? Yeah. I think your best bet, what I would look at,
actually I'm not sure.
Look at the CSP, so the Chartered Society of Physiotherapy. I would recommend looking at their website, because on the website they have a list of all the different universities within a list of all the different universities that provide physiotherapy courses. Another thing is that I'm pretty sure a lot of them have like reviews, so other students and things can have reviewed attending those courses or how they felt about them. I can only speak from experience in terms of where I went. So I went to St. George's and did the MSc, as I said. Really enjoyed it. Very, very thorough. I know that we kind of had like a semi-rivalry with like Brunel and King's, because they were also really good in terms of from a physio point of view. So yeah, George's, Brunel, King's. That's where we tend to typically get, from a London point of view, that's where we typically get most of our students from, in terms of when we're doing placements and looking after students when we're working. They tend to be from those three universities. But I know Birmingham was really good too. That's fine. How much responsibility are you given on placement at uni?
Oh, we can't hear you, Tanisha.
But okay, no, we'll do this last question, but we have overrun a little bit, but we'll finish this question because I think it's quite
sorry.
No, that's okay. No, I enjoyed it. I'm like, keep telling you more.
In terms of responsibility, it really varies from placement to placement, and it depends on the area that you're working in. If you're on a placement that is sort of in, for example, elderly care or in orthopedics, or sometimes in outpatients as well, you might be given your own caseload after a period of sort of supported practice with your educator as well. You might have responsibility for seeing your own patients and just feeding back to your educator to let them know, feeding back on how sessions have gone and what your plans are, and talking through sort of future plans. And you might have some responsibility in terms of doing onward referrals, or communicating with other members of the team, or communicating with family members. It sort of depends on the complexity of the patients and the number of patients, and also the experience that you've had and that you've had so far in your degree. But generally, at the beginning of a placement, you will have a chat with your educator and sort of plan objectives of what you want to achieve, and then the what you do during the placement will generally be working towards those objectives. There are some placements, for example, in the area that I work in, which is a sort of complex neuro rehab centre. Students aren't generally given their own caseload. They'd still be seeing patients by themselves sometimes, but we do more of a sort of combined working, seeing patients together and planning together, because the patients are sort of a slightly more complex level. So you wouldn't be expected to be able to just come in and manage patients by yourself. So it sort of depends on the area that you're working in for the placement, but you will students coming into a team are supernumerary rather than responsible for a certain proportion of the patients that need to be seen. So you shouldn't be going into a team and being expected just to work as a member of the team. Your educator is there to support you and make sure that you're learning while you're there. So any responsibility given will be for your learning rather than just because they need you to be doing jobs to make sure that the work is
and
done.
actually everything that you do in terms of like the notes that you write and everything is looked at and countersigned by your supervisor and your educator. So if anything, the responsibility is on them rather than necessarily on you. You're there to learn, and we're meant to be there to help facilitate your learning. I would say by the time you start getting towards the latter placements, you will start to be taking on a little bit more, and by the last placement they'll be kind of looking to you to be a little bit more like you're basically a member of staff. Not that the responsibility or the in terms of not that you would be taking those patients and this for yours, but it would still be signed off by your supervisor, but the responsibility, they'll be looking at you to kind of step up a little bit more. After you've finished, that's all you get. And then once you're out in the world, you're going to be fully responsible in seeing these patients yourself. So yeah, we hope that answered most of it. It's all right. No worries.
Thank you so much.
Awesome.
Coming to talk to us about all things. I just wanted to say, like, on behalf of everyone, thank you. That was really interesting to see sort of your pathways as well, because I feel like with COVID, everyone's a little bit lost when it comes to trying to get experience and stuff. But you've sort of demystified the application process. So thank you so much for coming to share your experience with us. And to all the people watching, if you want, they've put links in the chat with their podcast and their Facebook page. So do have a look. And so, yeah, thank you so much.
No worries. Thank you so much for having us. It was great.
Thanks, guys.
All right, thanks, Tanisha.
Bye.